The WHO says that this figure is more likely to be linked to direct deaths rather than indirect. When we talk about excess deaths, we're looking at comparing the mortality rate within a particular year to what the average or expected mortality rate has been by a trend. And to see this big gap really is one of the best ways to be able to identify the cause, the sheer scale of deaths linked to COVID-19. And a couple countries particularly have a big deviation from what they reported, India being one of the top countries where the figures are much larger than what was initially reported. So up to 4.7 million, or a quarter of overall of the global deaths in India alone. Of course, this is very troubling for the Indian government in order to explain away these differences.
Yeah, and it was at the time of that awful outbreak in India, it was always considered that the numbers were far higher because they just couldn't even contain what was going on, let alone keep track of information, which I guess is probably why this number has blown out so much, because many countries struggled with that.
Absolutely. And India had one of the most significant second waves and with lack of resources in terms of hospitals and a huge oxygen crisis, which meant that many people were spending so much money trying to get care outside of the official healthcare system, and were actually, turning to the internet and other places to get secure oxygen for loved ones, and ended up just getting empty fire type of extinguishers. So horrific scenes that unfolded, and that is just being dug into as well. And there were other countries in South America where it was similar. But looking at excess deaths, places like Australia, for instance, there was actually a decrease. So in terms of protecting the well-being of the nation, Australia fared very well in comparison of excess deaths. Part of excess deaths figure also mean that those who were denied care for other healthcare conditions, who would needed other treatments and weren't able to access them, either because there wasn't space in hospitals, ambulances couldn't arrive in time, all these other additional pressures that are not only related to COVID-19 would be accounted for in general when we discuss excess deaths during this period.
Okay. Well, let's come to this rather mysterious illness that has sort of popped up in over 200 countries now. This liver condition amongst children. What is our understanding of what might be causing this phenomenon?
Well, there are several working hypotheses about what could be causing this this form of hepatitis. It's not A to E. It's not any of the ones that we have recognized. So it's of unknown origin or etiology. And so it is puzzling for many scientists to get to the bottom of what is causing this. There are, however, public health agencies are working through a series of hypotheses. So it could be a cofactor infection. So we're looking at adenovirus 41 at the same time as perhaps even a COVID infection or a prior COVID infection that could be behind this inflammation of the liver. It has been so severe that 18 children so far have needed liver transplants, and one has even died. So it's not very unusual to see some form of mild hepatitis connected to these type of viral infections, such as adenovirus, but not to the extent of requiring a liver transplant or death. So that part is definitely unusual, and that's what is causing alarm. So there could be a co-infection. It could be that there is a new type of pathogen, whether that is a new form of adenovirus or even a new coronavirus is being considered as a potential culprit as well. Less likely, it could be a toxin or an environmental exposure, but given that it has been in 20 different countries, this is less likely just because of the geographic dispersal itself. So from that perspective, it is still the epidemiologists here are investigating all of the potential causes of this disease, and they'll be working closely with other healthcare professionals to come to an understanding, including whether this is, again, a type of virus that has jumped over from animals into humans.
Yeah, and so that makes it quite tricky, and I apologise, I said 200 and you quite rightly said just 20 countries, but nevertheless that is quite a geographical spread. So when starting an investigation like this, how complicated is it?
Well, it's actually very similar to the type of investigations that were required to uncover the origins of COVID-19. So you do need to do quite a lot of contact tracing, and also just looking at all of the different factors of exposure. So for all the children that were affected, where were they? Who were they in contact with? Was there anything new that they were introduced to? Another working theory, which I believe you alluded to earlier, was also that there's just been this, due to the isolation over the past 2 years at various intervals, there has been a lack of sort of immunity or exposure to other viruses that could be also problematic, and a worsening of this type of illness because of that lack of exposure to various viruses in the past as well. And while it's in 20 countries, there are, as you say, almost 300 cases. So I'm not surprised to see that there is such global dispersal, because with viruses, we see that, within a blink of an eye in this globalized world, it doesn't take long for these types of viruses to spread.
Transfer. Oksana, appreciate your time. Thank you so much.
Thank you.